Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. I would like to review for you the themes or articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the May 2012 print journal, along with the accompanying editorials. First, though, I would like to point out a new feature on our website. In the left-hand column, we have started a series entitled Meet the Mayo Clinic Proceedings Editorial Staff. This month, in May, we are featuring Terry Jobke, our new managing editor. This new feature actually began last month, but I forgot to tell you about it. To see the biography of Dr. William Lanier, our editor-in-chief, who was featured in April, please check the archive of the Meet the Mayo Clinic Proceedings Editorial Staff feature. This month's Editor's Choice is an original article entitled Relationship of Zolpidem and Cancer Risk, a Taiwanese population-based cohort study. This article was authored by Dr. Chia Hang Kao and colleagues from China Medical University in Taichung, Taiwan, and several other Taiwanese medical institutions. The authors used data from the National Health Insurance System of Taiwan to investigate whether use of zolpidem was related to cancer risk. They identified almost 15,000 patients who were first prescribed zolpidem between 1998 and 2000 and followed them through the end of 2009. For each patient, the authors randomly selected 4 comparison patients without a history of using zolpidem, matched by sex and age. After adjustment for demographic characteristics and comorbidities, the study found that the risk of developing any cancer was greater in patients using zolpidem than in patients not using zolpidem. In particular, the hazard ratio for patients taking more than 300 milligrams of zolpidem per year was 2.38. The cancers for which risk was highest were oral, kidney, esophageal, breast, liver, lung, and bladder cancer. Men were at higher risk than women. The accompanying editorial entitled Insomnia, Hypnotic Drug Use and Patient Well-Being, First Do No Harm, was authored by Dr. Barbara Phillips from the University of Kentucky College of Medicine in Lexington, Kentucky. She discusses that people with insomnia are not healthy people in that they are more likely to smoke, be obese, and have chronic medical or psychiatric conditions. These facts could explain some of the unfavorable outcomes in patients taking hypnotics that have been reported. She emphasizes that association of increased cancer risk with use of zolpidem does not prove causality. However, Dr. Phillips suggests that the possibility that hypnotic drugs themselves may be harmful should be recognized. She discusses the benefits of cognitive behavioral therapy for the non-pharmacologic treatment of insomnia. She closes with stating that with respect to the management of insomnia, only 2 things are sure. First, the more one worries about insomnia, the worse it gets, and second, the evidence against chronic pharmacologic treatment of insomnia is much stronger than the evidence in favor of it. A second theme in this month's issue of Mayo Clinic Proceedings addresses adiposity. The original article entitled Anthropometric Correlates of Total Body Fat, Abdominal Adiposity, and Cardiovascular Disease Risk Factors in a Biracial Sample of Men and Women was written by Dr. Tiago Barrera and colleagues from the Pennington Biomedical Research Center in Baton Rouge, Louisiana, and the Sanford Burnham Medical Research Institute in Winter Park, Florida. The authors performed a cross-sectional analysis in a biracial sample of over 2,000 individuals aged 18 to 69 years. They measured in all patients weight, hip circumference, and the ratios of waist to hip, waist to height, and weight to height, and the body adiposity and body mass indices. These measures were compared to body fat and percentage of fat measured by dual energy X-ray absorptiometry and abdominal visceral and subcutaneous adipose tissue measured by computed tomography. The authors found that most of the common anthropometric measures were moderately to highly correlated with the measurements of total body fat and abdominal fat obtained with the more involved techniques that require imaging. In addition, the odds of having an elevated cardiometabolic risk based on traditional risk factors were increased more than twofold per standard deviation increase for most of the anthropometric variables. Therefore, this study provides a link between simple anthropometric measurements and the health effects of adiposity. The original article, The Obesity Paradox, Cardiorespiratory Fitness and Coronary Heart Disease, was authored by Dr. Paul McAuley from Winston-Salem State University in Winston-Salem, North Carolina, and several other national healthcare institutions. The authors analyzed data from over 9,500 men at a mean age of 47 years who had documented or suspected coronary artery disease. Body mass index, cardiorespiratory fitness, which was quantified as the duration of a symptom-limited maximum treadmill exercise test, waist circumference, and percent body fat were all determined. Over a mean follow-up of 13.4 years, there were a total of 733 deaths, of which 348 were cardiac. After appropriate statistical adjustments, men with low fitness had a higher risk of all-cause mortality, no matter if they were normal weight or obese, compared to the reference group of men with normal weight and high fitness. Conversely, among men with high fitness, there were no significant differences in cardiovascular and all-cause mortality across the different categories of body mass index, waist circumference, or percent body fat. The authors conclude that using adiposity to assess mortality risk in patients with coronary artery disease may be misleading unless fitness is considered. A video interview with Dr. Chip LaVie, who was a co-author of this study and also is a member of our editorial board, can be viewed on the homepage of Mayo Clinic Proceedings.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.